morning, everyone. I thought it's Sunday and I'll be free, but I've delivered 2 since morning.
Wow.
And still 2 more to go.
Wow. Busy Sunday.
Busy Sunday. Thank you very much for joining Insta Live. So everyone, Vrinda is now my daughter. So, doctor, she is a lawyer in a very big firm in UK. She was in UK all this while. When she met me for the first time, she was visiting her parents. And from there on, this journey has started. She was a, I think, very aspirational girl. बहुत ही healthy eating, regular exercise. This was her motto in life, like healthy lifestyle. And she is actually doing good in her life even now. But professionally, she was doing really good, and pregnancy was not one of the tick mark in her list. She was doing good and she was wanting to progress in her career, and that only focus was healthy lifestyle. मगर जो cascade of events हुआ वो कहीं भी expected नहीं था, because she was she was maintaining such a healthy lifestyle. And she was in UK where air and other things, atmosphere is also very healthy. But first time when we met, from there on the journey started, and it was like repeated miscarriages, or we could not continue with pregnancy. Getting pregnant was not difficult for Vrinda. It was always accidental and always happened. But I have never seen such a person with full of humor, sense of humor, so good, full of life. She always joked about her condition. अगर आप सुनेंगे तो आपको समझ लगेगा कि कोई भी डिप्रेशन में चला रहा था. I don't know, she never showed that face of hers to me. तो वृंदा थोड़ा सा अपने बारे में बताइए पहले तो, और फिर सवाल पूछते हैं कुछ. Why multiple miscarriages and what should be done, all those things.
I think the only fact was I used to keep coming to you. I used to travel from the UK and I used to come to you and see you. And my mom had introduced you to me, and I decided that day I met you that you are going to be my doctor. And मुझे किसी ने बोला भी था, like some astrologer, somebody said that all you need is a progressive doctor who knows how your condition is and they can help you. And in the UK that wasn't possible, I thought, because वहाँ पे हमेशा midwives होती हैं and never see a doctor. So then that time I decided, कुछ भी होगा, whatever the condition might be, whatever the result might be, I'll come and see you. And whenever I've come to India, I have been pregnant. You know it. I mean, it's always been accidental, and we've always joked about it. But I've come to you and saying, listen, I'm pregnant again, and what do we do now? So I remember coming to you when I was third time pregnant. The first 2 were in the UK when I had miscarriages. And I couldn't understand why, and कुछ भी tests होते थे, they were very sort of basic tests, like जो भी doctors बोलते हैं fertility के around, and I couldn't understand कि क्या problem आ रहा है, because I conceive easily and it's just the fact that I can't carry. And this was my 3rd pregnancy when I was with you, and I had a lot of bleeding. I was admitted also in CK Billa for such a long time. I remember it was the toughest time in my life. And I did go into depression as well. I spoke to some therapist as well. I took some sessions. But I think I realized that I had to fix myself rather than somebody else fixing me. And not just me, it was my husband as well. And my parents and my in-laws. We all went through it together because it was everybody's loss. And I remember you hugged me and you gave me a kiss before my surgery when you were about to do my surgery. And it was the toughest time in my life.
I remember that was, I guess, almost 14-15 weeks when
16 weeks, yeah.
So that was a tough pregnancy that
we thought. I was on bed rest as well, I remember, for such a long time.
इस बार तो हो ही जाएगा, हमें लग रहा था कि इस बार तो 16 हफ्ते
हाँ, मैंने बोला 16 तो मैं और ऐसे ही निकालूंगी, बेड पे होंगे, आप टेंशन मत लो। आई यूज्ड टू कीप जोकिंग।
मगर उसके बाद भी वो नहीं कंटिन्यू हुई। फिर उसके बाद बहुत सारे टेस्ट हुए, क्योंकि जो आपके जो बेसिक टेस्ट थे वहां तो कहीं प्रॉब्लम थी नहीं, जो कि नॉर्मली हम लोग एकोस्प्रिन दे दिया
यप।
और प्रोजेस्टेरॉन दे दिया, और हमेशा
हम्म।
सोचा कि या तो यूट्राइन इन्फेक्शन इज द कॉज,
या
या मिलने से ब्लड सप्लाई ठीक हो जाएगी, या डेफिशिएंसी ऑफ हार्मोन is the reason. But in your case, this was not the reason. The reason was somewhere hidden, which uh, you researched, and how we moved forward.
या
So
सो
tell.
yeah, so after my fourth miscarriage, I was disheartened, and my mom said कि तुम पहले ढूंढो ये क्यों हो रहा है बार बार, don't spoil your body, there must be something. And then I thought, by that time I thought I'll adopt. बस हो गया अभी, maybe it's just not meant for me, and it's okay, I want to adopt as well. And that was my, I was open about it. Uh, but then I wanted to give it one last try. I thought एक बार और देखते हैं. I haven't explored the area of immune treatments, and that might be something I could be on to. हमारे फैमिली में autoimmune disorders हैं लोगों को, and it could be something that I have, but I wasn't sure. So I went to this doctor in the UK. They did some battery of tests on me and some tests on my husband as well, like DNA matching, DQ alpha, whatever technical terms they were, and very expensive as well. I thought, let me try and see what happens. And I somehow knew that I'll find my answers here. Just had that gut feeling. And वहाँ पे हमें मिले भी answers. We found out that I have a blood clotting disorder, some random name, I'm not sure क्या होता है वो, but it's apparently very common. India में बहुत लोग को होता है, especially north में, north of India में. That's what I was told. Then I had some immune issues which needed some sort of immune sort of medication when I'm pregnant again. And that doctor asked me to start those medicines even before I found out I'm pregnant, before I even try for pregnancy. And I remember calling you and asking, मुझे ये मेडिसिन लेने को बोला है, मैं ले लूं क्या? मतलब मैं उनकी बात में नहीं बिलीव कर रही थी, whom I paid so many pounds, but I wanted to ask you, listen, can I take this? He's like, हाँ हम बहुत लोग को देते हैं, ले लो. So I was like, fine. And then I told you that I'm coming to India in Feb and I'm going to come and see you. And you were like, yeah, fine, go for a coffee and things. And that time I remember we went for a coffee and I remember telling you, listen, my period hasn't arrived. And you were like, Pakka pregnant hogi. I was like, no, I've been pregnant so many times. I know how it feels. This time it doesn't feel. ये जरूर कोई नई medication की वजह से ऐसा my period has been skipped. And 2 days later I was in your room. I'm saying, listen, I'm pregnant. What do we do now?
तो मुझे जहां तक मतलब जैसे आपने भी कहा, so there is a entity which is called immunotherapy, और हम लोग ऑटो इम्यून डिसऑर्डर्स को बहुत ही आउटराइटली रिजेक्ट कर देते हैं, और जबकि ये बहुत सटल तरीके से है हमारे बॉडी में, हिस्ट्री है, अगर फैमिली हिस्ट्री है तो तब भी हमें ये कोई हमें वी कैन बी प्रोन to have auto antibodies in our body, and tests are definitely expensive. In fact, मतलब आपके साथ जब बात की तो मैंने कहा कि हमारी बुक्स में लिखा है कि first 3 months तक we have to give steroid and autoimmune therapy if there are repeated miscarriages. But I think somewhere mental block is there when you give, because मैं तो वृंदा रोज ही फर्स्ट ट्राइमेस्टर ब्लीडिंग देखती हूँ, और जैसे ही फर्स्ट ट्राइमेस्टर ब्लीडिंग देखो आपको एकदम लगता है कि some rejection process is going on. Okay, apart from infection, apart from hormonal deficiency and all those things, because in my practice I see uterine abnormalities also very often.
Yeah.
Septum है uterus में, उसको ऑपरेट किया, इट्स अ वेरी सिंपल, ऑपरेट किया और अगले ही बार वो ठीक से प्रेग्नेंट भी हो जाते हैं, नॉर्मल डिलीवरी भी हो जाती है. एंड देयर सो मेनी पेशेंट्स हु वुड डेफिनेटली, हु आर लिसनिंग, उन जो जिनके की सेप्टा रिमूव हुए हैं और उनको प्रेगनेंसी हो गई है, वहां पर एक बहुत सिंपल रीजंस भी हो सकते हैं. जब रिपीटेड अबॉर्शंस होते हैं, जैसे आपके केस में बहुत आसान था प्रेग्नेंट होना, बट रिपीटेड अबॉर्शंस हो रहे थे, तो हमें ये समझना कि हमारी बॉडी में कुछ रिजेक्शन प्रोसेस चल रहा है, और उसके लिए जो दवाइयां हैं वो स्ट्रांग हो सकती हैं, मगर वही लाइफ सेवियर है, वो थोड़ा मुश्किल होता है. क्योंकि वृंदा आपने तो रिसर्च भी किया और आपने बाहर के डॉक्टर से भी बात किया, तब आपको ये एक्सेप्टेंस अपने आप आ गई थी कि हाँ अगर मैं आपको स्टेरॉइड चला रही हूँ तो दैट्स ओके, दैट इज
needed, yeah.
so what also one thing is battery of tests were done on you, जो कि बहुत सारे थे, और मेरे ख्याल से जो भी रिपीटेड मिसकैरेजेस से गुजर रहा है, तो अपार्ट फ्रॉम क्रोमोसोमल एब्नॉर्मैलिटी विच इज नॉट अ रेपिटेटिव थिंग बेबी में जो क्रोमोसोमल एब्नॉर्मैलिटी होती है, इन्फेक्शन है, इफ दैट इज आल्सो ट्रीटेड, बट hormonal treatment given, low no pen or all those low molecular weight heparin is given, still there is no success either in IVF or natural conception proceeding or culminating into pregnancy. I think हमें और चीजों का भी investigate करना चाहिए. बताओ वृंदा.
Yes. So I think because I had these immune testing done, so I remember, I don't know if I should mention कि हमने क्या medicines लिए. I'm not obviously authorized or Can I mention like हमने क्या treatment किया?
ब्रांड नेम के बिना तो हम लोग, क्योंकि आपका तो एक मतलब एक्सट्रीम स्पेक्ट्रम का राइट एंड ऑफ इम्यून थेरेपी चल रहा है, दैट वाज दी.
Exactly.
तो अगर मैं आज वृंदा किसी को ये बोलती हूँ कि आपका ग्रोथ रेस्ट्रिक्शन हो रहा है बच्चे में इस लेवल का, और ब्लड सप्लाई कम हो रही है, तो आपको IVIG लेना होगा, जो कि एक इंजेक्शन 50,000 का हो सकता है. तो आप उनका एक्सप्रेशन देखिए कि मतलब ये क्या बात कर रही है डॉक्टर, ये कैसे.
Exactly.
So have been through that phase. So yes, you please share. Okay,
Yes.
what kind of extent we went.
Yes. So I think this pregnancy also wasn't easy when we started. I mean, at least I didn't bleed. जैसे पहले बार में first trimester bleeding बहुत ज़्यादा हुई, but there was still like hematoma जो भी कहते हैं, वो बैठा हुआ था. And we were worried कि ये फिर आ गया and that might just haunt us. And because that was a sort of a regular in my pregnancies. हमेशा ये होता था. Internal bleeding was always there. And I had researched so much on it. मतलब मैं एक बुक लिख सकती हूँ, मुझे लगता है कि मैंने हेमाटोमस के बारे में इतना पढ़ लिया उसके बाद क्यों होते हैं. एंड जो भी कहता है ना कि इसका कोई रीजन नहीं होता, मैं कहती हूँ मुझसे पूछो, आई हैव अ लिस्ट कि क्यों हो सकते हैं. So I think this pregnancy also, which was the successful pregnancy, I also had a hematoma which was much smaller because we had started the right kind of treatment. But जब मैं आई थी तो I was already obviously I think 4 or 5 weeks when I'd come to you. Had I started a bit earlier, शायद I feel that वो भी ना होता problem. But then we started on some steroids. We were doing intralipids, which is also an immune therapy. And I remember the doctor in the UK had told me that I might need something called LIT, which is husband's white blood cells being, injected into my forearm. But I wasn't convinced. I was like, ये क्या है? कुछ अजीब सा sound कर रहा है. But then I asked you and you said that's also a line of treatment, but you have to speak to an immunologist about it and things like that. And then I think I was in my second trimester and I started bleeding all of a sudden and I was shocked. And because सब कुछ सही हुआ था, 12th week scan में वो hematoma भी चला गया था. There's no internal bleeding. It was on track. And सब वो NIPD tests and all, they were all fine. And suddenly at 14 weeks, I was bleeding again and I was in a shock. And I remember I was sobbing रात को घर पे and I was like, and didn't tell my parents कि ऐसा हुआ है. I didn't tell anybody except my husband कि ऐसा हुआ है. And then I was like, सुबह जाके I'm going to get myself seen कि क्या है and go for a scan and everything. And we went for a scan. तो उसमें एक फिर से एक hematoma था, but it was away from the placenta. And I was like, God, फिर से आ गया ये. And then you said to me कि bed rest कर लो, आराम करो, and we'll increase some of your medicines and let's see what happens. And then I remember आप रात को घर आए थे one of those days में, and I said to you, listen, let's try and save this pregnancy. That's all I want. And you said, fine, we'll do what we need to. And then I remember you messaged me that let's try IVIG because I had also read about it. And you said you've spoken to an immunologist who's in the hospital and they'll be with you throughout and let's see how it works. And I said, fine, I have nothing to lose except the money part of it. And I was like, fine, let's try it. And then हमने वो IVIG करा, which is so expensive.
But it was expensive, more expensive.
हाँ, of course. हाँ, you got me a good discount on it. और it was so funny. It's like, क्या मुझे present में दोगे? मैंने कहा, I'll take you to Blue Tokai for a coffee.
Good.
And then I had my first IVIG treatment. पूरा दिन लग गया उस solution को 3 bottles जाने में. Depends on your weight, this medicine, how much is your weight, and then how much IVIG you need. These are sort of good antibodies which protect your body from rejecting the pregnancy. And then I think after a week we had a scan and वो hematoma जा चुका था. Like I remember Dr. Molshi was scanning me and she's like, I can't see it. And I was like, are you sure? She's like, हाँ नहीं दिख रहा. And she's like, नहीं दिख रहा तो मैं कहाँ से ढूंढ के लाऊंगा? I was like, wow. And I came to her all smiling and we were all like fingers crossed and we decided we'll continue with IVIG and we stopped intralipids because there was no point doing the same thing दो बारी. उसके बाद I remember I was still not sure कि everything will work out, but I used to maintain a face कि सब ठीक होगा, टेंशन की बात नहीं है. But internally I was mentally really disturbed. I used to fear that I might start bleeding again. एक वो था, like there was this thing, I had become superstitious because it was Friday when I had bled first, I remember. And every Friday I used to be scared. I never mentioned this to anybody, but मैंने अपनी कभी भी कोई insecurity किसी को देने की कोशिश नहीं करी, like my parents or my husband. I just kept it to myself, very calm. And I joked about it all the time. But yeah, it was difficult.
You are brilliant. And after that, I guess, after that, there was nothing like absolute went smooth.
Yeah, it was all smooth. हाँ. I never messaged you urgent. Problem है. I was like, हाँ मैं आराम से आऊँगी अब. आपको मिलने आऊँगी.
You never had to.
Yeah.
So yeah, so after this story, which is like you have made it so easy, which was not easy actually. तो उसके बाद हम सब कुछ क्वेश्चंस अराइज होते हैं दिमाग में कि सबसे पहली बात जैसे आपने कहा कि in spite of we being so close, I've been coming to your house because I was so close to you. I as you once said, I am a lady on mission to have
mom on a mission.
So that mission I also shared with you. I said ki I have to give you a baby in your lap. But you see, even after such a support system around you, your in-law, parents-in-law, and sister-in-law, and everybody, and parents, brother, husband, still there were few things which you were keeping inside you and not letting anybody know. And so, as I said, that you are such a jovial person, good sense of humor and everything. But do you think that this should be addressed, and psychological aspect of it is a huge burden on anybody, any girl? And we never speak about it. We say, okay, if she's sitting with everybody, everybody is laughing around her, she should be okay.
Yeah.
Isn't it?
Exactly. Yeah.
I
always, yeah. Sorry.
Counselor's help is needed, and we should always seek counselor's help. So even family, even if they are supportive and they talk about it, but we should actually go and seek professional help here because it's very difficult. So physical health, agar aap physically you have been through abortion or mid-trimester abortion, उसको 3 से 4 या मैक्सिमम 6 हफ्ते लगते हैं रिकवर करने में, मगर मेंटल हेल्थ को रिकवर करने में 3 to 6 months लग जाते हैं. You need bravery to get pregnant again. Scared to go through. They just want once.
Yeah.
Upon a time, you also thought that it's okay to abort.
Yeah.
Right? So,
exactly. Yeah.
Isn't it? And any other questions to your mind, Vrinda, after yours?
Yeah, I think I made a list of questions. Let's see if we haven't. We spoke about, we've spoken about this. No, I was generally thinking that I feel one good thing about UK, I thought, was there's a lot of mental health support, even from work, in terms of holidays. I know this is something which doesn't concern you or anybody, but we can talk about it so that, this can get into the media sort of places where women are struggling and, they still have to go back to work. I know people have had stillbirths and they don't get maternity leave and things like that, which is just the worst thing you can face. So I think that's what I feel like India should be more empathetic about it. There should be workplace policies. I'm sure there are some workplace policies, probably I'm not aware of. But in terms of mental health from family as well, I think sometimes family also tries to brush it aside. But that's how every family would be different. They'd be like, हाँ कुछ नहीं होता, फिर से try कर लो. Things very very random things people would come and tell you, and some advices don't make sense. I used to ignore them. कोई नए डॉक्टर के पास चले जाओ types.
Everybody as you are.
Yeah. So these kind of things I thought we should speak more about, because talking about miscarriages is such a taboo. Even fertility issues for that matter. I have so many friends. I made so many friends in this journey. I came across so many people because I shared my story, and so many of them told me about themselves. And it sort of, I'm not being sadist, but it sort of helped me so much. I have so many friends during this period when I was pregnant. I found out either they have adopted or they are pregnant, and it's all going very well. So I was really, really happy for them. And I only just pray for friends who are still waiting and longing, and I'm sure it will happen for them as well, because yeah, I mean, I'm going to share this video with them as well, and I'm going to ask them to have a look and see how my journey, it wasn't easy at all, if anything.
Best to them, and now they have, again, through you, now they know the treatment options
Yes.
to the extent they can get. So
There's another thing I always notice anywhere with doctors. They don't encourage, sort of, the only thing they say is weight lose kar lo. They didn't say it to me, I didn't need to lose any weight, but I've generally heard कोई PCOD कोई किसी कुछ भी होता है, weight lose करो सब ठीक हो जाएगा. Nobody says that, oh, lifestyle modification might help. So something that I feel like even doctors should dictate, rather than saying simply अरे weight lose करो, बेचारे खाना नहीं खाएंगे फिर दिनों दिनों तक कि weight lose करना है. No concept of healthy eating, I guess. So
इंडिया में वैसे भी एक्सरसाइज का बहुत ट्रेंड है भी नहीं.
हाँ, है भी नहीं. I agree.
पूछते हो आप कितना एक्सरसाइज करते हो, तो एक्सरसाइज, अच्छा, सी हाउसहोल्ड चोर्स वी डोंट डू, एंड एक्सरसाइज आल्सो वी डोंट डू. सो वी एक्चुअली डोंट डू एनी काइंड ऑफ फिजिकल एक्टिविटी. वी जस्ट हम अपनी क्लॉक को ऑन कर देते हैं और सुबह से उठ के जितने भी स्टेप्स लिए उसको एक्सरसाइज में इंक्लूड कर देते हैं. तो एक फिटनेस होना बहुत जरूरी है फॉर मेंटल एज वेल एज फिजिकल वेलबींग, और वहां से हार्मोनल मिल्यू भी ठीक हो जाता है आपका, और मेनी अदर थिंग्स लाइक योर कोलेस्ट्रॉल लेवल, शुगर लेवल, बीपी लेवल, एवरीथिंग इज अंडर कंट्रोल. मतलब बहुत यंग एज में भी people are getting so many lifestyle disorders, metabolic disorders, which is not a good thing to do. Yes, it's rightly said कि healthy lifestyle or regular exercise and good healthy diet should be incorporated.
Yeah, that's what I feel like. I always give free advice कि अरे healthy खाना खाया करो, like don't diet and don't eat ये सब junk ice cream कम खाओ. But फिर मुझे ऐसा लगता है why am I giving free advice to anybody, जो किसी को मानना ही नहीं है. सबसे पहले I tell people that delete, India में especially, delete Zomato and Swiggy from your phone. Sorry. I know ये तो मेरे को कट करना पड़ेगा नहीं इस वाली बात को.
Mostly
delete
we are
food apps.
dependent on food delivery system, and same is like we should always order less and try to home cook.
Sorry. But yeah, and जैसे अभी I'm after your life कि please go give me a go ahead, I want to exercise again, but you're like नहीं अभी नहीं.
करेंगे अभी स्टार्ट करेंगे, 6 weeks तो होने दो.
Yes, that's what my mom says. थोड़ा धीरे धीरे चलो बेटा.
And what else? I think we can, और किस चीज तरीके से इस इशू को एड्रेस किया जा सकता है. एक तो साइकोलॉजिकल सपोर्ट इज वेरी वेरी इंपॉर्टेंट. हेल्दी लाइफस्टाइल इज वेरी वेरी इंपॉर्टेंट. Another thing is, like as you said, research has to be done. Doctors should be open to many other treatment modalities and see whether, आजकल तो अपडेटेड रहना भी बहुत जरूरी है, और अदरवाइज ऑल्सो फॉर डॉक्टर्स एंड फॉर इन एवरी स्ट्रीम you should be open to new ideas, new treatment options. You should explore and you should be open to the ideas. If somebody else is bringing some idea to you with some question mark, can I be suffering from this or that? I think we should be open and should not feel that it is belittling us or our knowledge or underestimating us.
Exactly. I think the fact that you were open to, when I told you, like, this doctor told me this is this, and you're like, yeah, yeah, we'll try all of it. Don't worry. And that's what a progressive doctor is, that they're open to listening to others and what others have recommended. There's no sort of shame in agreeing that ये हमारे से नहीं आई है, this advice. So that's what I felt was really helped. And had I gone to somebody else, maybe they would have brushed it aside. Maybe they would have said, "Hey, ये सब ताम झाम हमें नहीं समझता," because they don't understand. They're like, no, it's so expensive. Don't bother. You never know it will work or not. And then they might think I might come and say to them, "इतनी expensive treatment कराई and it didn't work out." But that was never the case with you. You were open to trying everything with me. And you're like, no, we'll try this. Let's see if that happens. And that's what I think, that attitude sort of really helped me. Otherwise, I don't know if I would have my little girl today with me.
No, Vrinda, it's like quite a mutual respect, openness, which we are lacking nowadays. हम लोग patient knowledgeable है, पढ़ के आ रहा है. So you should have an open discussion. Everything should be on platter, what all you have to offer to patient and what patient knows about it. And if they have any sort of query, even if it is internet से gain की हुई knowledge है, फिर भी knowledge तो है, और we should actually address, because if we would not correct that wrong knowledge, then who is going to correct?
Exactly.
Give that knowledge forever. तो अगर वो उस नॉलेज से आते हैं तो मेरे ख्याल से हमें उन्हें वहीं पर करेक्ट भी करना है या बताना है कि ओके दे माइट बी राइट इंटरनेट का इंफॉर्मेशन एंड लेट आस सर्च. सो समटाइम्स आई आल्सो स्टार्ट ओपनिंग गूगल के कहाँ पढ़ा आपने, इसका और रिसर्च टॉपिक क्या है देखा जाए. So I think it's okay. It's like learning is never ending process. You should always be open to that. But I always said that Vrinda, yours was the longest pregnancy.
Yeah, continued for years. 3 years, to be honest, from day one when I started. And I remember it was October 2020 when I had my first miscarriage. And then October 2023, I got my daughter. So, yeah.
Thank you for staying with me. Thank you for trusting. So that trust and this relation is really important. तभी मेरे ख्याल से ठीक से treatment भी हो पाता है.
Exactly, yeah.
Beautiful result is there.
Yeah, मैं तो first time जब मेरे को दी, जब you gave us the girl and you're like, this is your daughter, this is your girl, I was like, पक्का हमारी है ना, किसी और की तो नहीं, इतनी सुंदर कैसे है ये.
Okay. So any last words, Vrinda?
No, I wish everybody all the best who's with you and whoever's watching it, and I'm going to forward it to some of my friends as well, I'm thinking. And it's a journey which is tough, and we shouldn't be ashamed of talking about it. If it's been a tough journey, we should all be open about it, and there should be no judgment. Even if people are judging you, just ignore them. Like, baad mein jaye.
And here, family support is very important. To be open to your doctor, to your family is very important. And as Vrinda rightly said, that psychological aspect of this repeated miscarriages, or even if it is first one miscarriage, should never be ignored. And we should always support the mom who was carrying it inside, who was looking forward to a child and could not get. It would take months for her to heal internally, psychologically. So all the very best to everyone. And thank you very much, Vrinda.
Thank you. Thank you for having me. I'll see you later.
Have a nice
Bye.
Sunday.